Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Shaun Keating.
Hey everyone, Shaun here. Welcome to another episode of the Dental Up Podcast. Our guest this week graduated from the University of the Pacific in San Francisco, California, where he received his Doctor of Dental Surgery degree. He has completed over 600 CE hours in the past 6 years and graduated from the Las Vegas Maxi Course Mini Residency in Implant Training, Multiple Sedation Training, Endo and Grafting. Currently practicing from Laredo, Texas. Please welcome Dr. Moeman Metwally. How's it going, Dr. Metwally?
How's it going, Shaun? I'm excited to be doing this with you guys.
That's so cool, dude. Hey, thanks, man, for your time. I appreciate it. And thank you for all the work, man. You've been with us for several years now. And heck, I never really even talked to you, I don't think, man. And I remember it was a couple weeks ago or something. One of my guys on social media, he was saying, yeah, there's this little thread talking. It was kind of like I think it was on the Dental Hacks or somewhere on Facebook, I think. And I'm not real big on all that. My guys do it here and stuff like that. But I guess someone was talking about just a bad lab or something. I dread that. I always worry about myself for years. Ever since that darn interweb came around and I started getting involved with Dental Town, I would worry, man, like Keating Dental Art sucks. And, I take it to heart, but, so I never like it when the lab's getting beat up. And my guy kind of jumped on with my name or something or saying, well, we could help you this and that. And I'm like, dude, don't. I felt to myself, no, don't do that. Then I think you had popped up and just kind of said something about Keating Dental Arts. I don't remember it exactly, but kind of to the point where, they're a little more expensive, but they're worth every penny of it. And it was just from your heart, man. And I just looked at that and I bounced on there when I seen that. And I said, well, thank you, doctor. And I just appreciate that. And I meant that too. And so a couple days later, I said, it was just in my heart, man. I'm like thinking of you. And I thought I'd give you a call. And we had a half an hour conversation. It was just great. And
yeah, it was way longer than half an hour.
I think it was.
Yeah, it's kind of hard to keep me quiet.
No, that's just so, but thank you so much for that. And you made my day. I mean, you talked about our staff and stuff like that, man. But
yeah, honestly, like I mentioned on the phone, we as dentists, obviously, and you guys as lab techs know this, we're never wrong, right? Like our preps are always perfect and our brushes are always amazing. And anything that doesn't work, it's got to be the lab's fault, So exactly. we live in that world, and it was just kind of funny that they were talking about this conversation online. And I was telling my wife later that I thought that group was closed to dentists only. So I had no idea that you guys would even come across it.
Okay.
And it was just it was an honest recommendation, and I've recommended your lab to many, many, many people. But I've been with you guys for many years, and probably above all is your customer service. I think I mentioned to you that when we were going through some consulting agency stuff, I'm a huge believer in customer service. My background before dental school was sales.
Okay.
So, we live and die by customer service, and everything comes down to customer service. And I believe as dentistry that we are healthcare providers, but we're in the service industry. And if you're going to have a hard time being in the service industry, you're going to have a hard time with dentistry. So I remember telling the office that I was working at the time that they should call Keating Dental Arts and have a conversation with the people on the phone and listen in to how they talk and how they answer questions and their note-taking abilities. And nobody's ever like throwing anyone else under the bus, and so many of these things you see on a daily basis in the dental office. And, I think we forget sometimes that dentistry is a people business.
Oh, it is for sure. And you have to be part psychologist, part coach, it's just, there's so many hats you guys wear. And it's one thing I've done
all day. Yeah, all day. You gotta, all day. Playing the psychologist role sucks, but all day. Yeah. Matter of fact, I just had a patient yesterday. I was doing a consultation. They put her on my schedule for an all-on-4 consult, and I walk in and half her teeth, she's got a couple teeth that are, that slightly periodontally involved, but the rest of her mouth looks fine. And I just don't understand. And she tells me that she just doesn't like her teeth and she just wants them all gone.
Oh,
and, having to sit there and, I can't just tell someone, oh, listen, you're crazy. You can't say that, right? So having to sit there and ease it out, it's like you're trying to tease it out. What is it that you don't like about your teeth? And, it's like, I can give you something else. You don't have to take your teeth out. Like, I love taking teeth out. Yeah. I love placing implants, but, it's not the right way to go. And we do play a psychologist role, which, sucks because I don't consider myself a psychologist. Trying to get in someone's psyche, and figure out what it is that's going on. And how did you get here? Why do you think your teeth suck?
Oh, no, I bet it's so tough. I couldn't even imagine, like all my years, we work on models and, they feel no pain, this and that, but I've been in a dental chair a lot and have a dental operatory here, so we do a lot of patients where we're working in the mouth, but it's tough. I mean, some practices, they get joyful patients, I'm sure, and stuff, but a lot of times I'm sure it's just, it's just tough to come to the dentist and just each person, either taking them out of pain or you're trying to help them with, function or you're trying to help with aesthetics. It's just so many different things on what it is that a patient needs for their mouth to, be happy. And it's just, my hat's off. Some guys really get it and some guys can. It's like when I was talking with you, it's just, you kind of get it.
And it's a rewarding field. When I run across some of my colleagues and they're great guys or whatnot, or gals, and I run across some dentists that are just not happy being dentists. And at that point, I really feel sorry for them because to me, and so many other dentists out there, like, I really enjoy what I do. Like a lot of my peers, we'd love to have more money. You want to have, passive income or whatnot.
Yes.
But at the end of the day, if I had all the money in the world, I'd still be doing what I'm doing. I'd just pick and choose a little bit more, but I'd still be doing what I'm doing. Like the idea of retiring and just sitting around the house all day would drive me nuts. Yeah. And my wife and I love traveling, and it's probably what we spend most of our money on is traveling.
Yep.
But I always joke that right around day 4, day 5, I am like itching to get in someone's mouth.
I bet. Yeah.
Like, I'm just like, you just start feeling useless. But if you're not in dentistry, I remember Dr. Dagoni, he's the one our school is named after. He's just a phenomenal dentist. And I remember right when we started dental school, he said something about how you got to be careful when you get out of dental school because dentistry will suck you in.
Yes.
And to a lot of people, you get good at dentistry, especially the ones that are really, really talented clinicians. And you get to meet some of these super, super talented clinicians. A lot of them are divorced and, are not good relationships with their kids and, they're on their third marriage and whatnot. And it's not because they're horrible people. It's just if you let dentistry suck you in, it will suck you in.
Absolutely.
And certain fields are like that. Some physicians are like that. It's rewarding. You get this instant feedback from patients. So you get a high right away. You get rewarded financially very well. Some of these guys make good money. Or if you're on a lecture circuit and you're standing up there and you're lecturing a couple thousand doctors and they look up to you, and then to be able to put that to get yourself out of that, to voluntarily get yourself out of that, right? And say, no, I'm limiting my hours to this, and I'm not going to work Saturdays, and I'm not going to travel this much, and I'm going to spend more time with my kids and my family. It gets kind of hard, and if you let it, dentistry will suck you in.
Oh, absolutely.
So, if you can find, to the dentists that are out there doing it right, I think they're the ones that can find the balance. And I have a couple buddies of mine that do a really good job at that, where they make sure that they only work 4 days and they travel enough and they, focus on family. But it's a tricky balance to get. And it's unfortunate when I run into dentists that are not happy being dentists because it is such a rewarding lifestyle. When I run into those guys or gals, I'm like, you've just gone down the wrong hole, and yep. You think that this is all dentistry's got to offer, but there's so many aspects of dentistry between academia or research or just being an entrepreneur and focusing on, opening offices or the guys that find a niche in dentistry and stick to that. So it's unfortunate when I run into those that are not happy being dentists because there's so much that dentistry can offer.
Yeah. And it's so true. And it's almost like with the people too, they probably wouldn't be happy in any other job. It's just sometimes you need to really work your life balance with, what's important. A lot of guys come out, and I never did it where I never did my job to thinking I was going to make money or to make money. Money will come. It really does. And if you're not thinking about that, and if you can pay your bills, I remember for the first 10 years of our lab, we made enough just to pay our bills and everything else. And I found out after a while, because I was flat rating everything, like flat rate gold crowns, this and that. And at the end of the day, when we did our calculations, it was like, well, Shaun, you're just breaking even, or, it was tough, and, you're trying to do what you think's right. But, it's all balance and how you,
but to our listeners, like whatever the listeners out there that are listening to this can relate to that. And it'll be the older guys that I bet are sitting there nodding their heads.
Yes.
Because, when you've gone through it, you realize that if you get off right off the bat, your goal is, I want to do the right thing and I want to learn as much as possible and I want to do the things that I enjoy doing. You're going to realize that initially you're not making a lot of money, and then it'll slowly progress to where you're not even thinking about the money, but the money's just coming in, right? Yep. Mm-hmm. And I think so. A lot of like I haven't been around very long, so I know a lot of the older listeners might be thinking I don't know what I'm talking about. But when I talk to them, they all have the same mentality. And personally speaking, when I first got out of dental school, I did a GPR and I lost. That's a huge loss of income for the initial year, right? Mm-hmm. And then I relocated to somewhere where I would make, have a job where I'd make a little bit more money than where I was living. And even that job that I relocated to, I left it because, if I wasn't getting that personal satisfaction, if I wasn't enjoying waking up to go to work every morning, it just wasn't worth it. And I took a huge cut leaving that job and going to another job where I was enjoying doing what I was doing. And then, to the guys that have invested hundreds of hours into CE education, you realize that time away from your practice is expensive. Paying for those courses are expensive. Paying for your hotel is expensive. The tension it puts on your marriage and your kids and, your personal life, But in the end, it's so worth it. And at this point in my life, again, like I've only been out for 8 years now, but at this point in my life, a good portion of my practice is based on, sedation dentistry and surgery and implant dentistry. And I don't try to do everything under the sun. I'm not doing retreating molar endos and doing apicos, and, I'm not doing massive veneer cases and full mouth rehab. I just found what I enjoy, and I took more courses in that. And, but initially when you're doing that, you're saying no to other things and you're losing that income. Right. So, but if you and I'm sure it's the same with you, as a dental lab tech, if you got out there and you were trying to do everything that every lab tech was doing, you weren't going to be where you are today.
Oh, absolutely.
So you just gotta, you find that and you just keep at it, and you realize that, what, I'm not going to be the pedo Medicaid office. I'm not going to be the veneer guy. I'm not going to be the implant guy. I'm not going to be this. You can't be the everything guy. Yeah. So you're going to have to say no to some things and lose that income. And before you know it, and honestly, in my situation, I felt like it wasn't, it wasn't many years. It was probably a year or two. And then things just kind of slowly rolled into it.
Absolutely. And what a story you got. We'll get to that on what you're traveling and stuff like that. It's kind of a trip, man. I couldn't believe when I heard it. But yeah, I always start off talking a little bit about sports real quick. I want to get that through because quite a bit of stuff, man. Did you watch that Kentucky Derby last Saturday, man? What the heck would happen there, man?
Well, I didn't watch it, but I saw the highlights. I guess it's the first time they were saying, first time that's happened.
Yeah, like 150 some odd years. Man, I used to really like kind of betting the ponies a little bit here and there, and I've talked about it years past on my podcast. And I just bet like a favorite, and I come to find out when you do your numbers, the favorite only wins a third of the time. And I always thought it was like 50-50. Really? So no wonder I've been losing my butt a lot of times on these favorites. But anyways, I went into this place because my wife's like, I haven't bet on a horse in months and months because, we have the local Santa Anita racetrack here in Hollywood and up there and stuff. But
right.
I don't really go to that. But there's like a little place called Sammy's where you can bet on horses across the nation, whatever they're running. But
so you can bet on the Derby there.
You can bet on the Derby. You can bet in Gulfstream. You can bet all these things. But so I haven't bet in a long time because there's been a lot of horses dying here in California, like 20 some odd horses, and it's kind of sad. And my wife's like, "Why are you?" And as I thought about it, I'm like, "Yeah, I don't really need to, and it's just kind of for fun." And I'm not a real big I just do one bet, And so, anyways, I told my wife, I go, "Well, it's a Kentucky Derby, baby. I got to do one bet." So I didn't even know because there was like 4 favorites. Baffert had like 3 horses, and I always loved this one. It was like one of the top favorites at the beginning. It was called Game Winner. So I'm thinking, I'm going to get in there. It's like 6-1 odds or whatever. I'm like, but anyway, so I'm going in there. I wait in line. Like me and my wife go there because we're just going to make the bet, and then we're going to go eat lunch somewhere and then come back later, like at 4 o'clock when it runs or whatever. But so I get in line and I go down and I talk to the guy and I said, "So, dude, who do you think, man?" I'm like, I'm thinking Game Winner, but I just want to bet on to win, no trifectas or anything like that. And he goes, "Well, man, a lot of money's going on this Mission Impossible. I think it's Mission Impossible or Maximum Security.
Maximum Security.
And I'm like, dude, what the heck's that one?" And it was like 9-2 odds, and I'm an idiot. I don't even know what that meant, but he was like one of the top favorites or whatever. So I said, "What the hell, man?" And I put a nice little bet on that thing, and I'm sitting there, and we're at our little Mexican restaurant eating our food, and all of a sudden the race comes on, and we're sitting there watching it, and I'm screaming kind of, come on, because it was raining, messy course and everything, and the damn horse comes in winning. I'm like, yeehaw, baby, and it's like... It was crazy, man. I was like really into it. So I really felt the win. I was all good. Hey, I'll take another beer, bartender. And
you got the rug pulled out from under you.
Yeah. And so I enjoyed the joy of it. I won it all. And then I'm sitting because it's no noise to it because it's like muted. It's kind of a restaurant area. So I'm thinking, what the heck's going on? My boy Travis is texting me. He goes, "Dad, I think there's a problem with that horse." I'm like, "What?" And sure enough, they freaking disqualified him. I guess he went out of his lane a little bit, but like $60-some-odd million that was won on this horse that all is nothing. And it's like, man, they don't even give you money back on your ticket or not. And it's kind of crazy, but yeah. So, but
the jockey, I remember like seeing the jockey's reaction. He was like heartbroken, man.
Devastating. And the dude that won was 100.
And they ran the race through like. Yeah, they ran the race through like puddles of mud.
Oh, it was crazy.
It was a crappy race.
It was, man. Yeah. And even I think Trump got on there and said, "That's horrible the way they just qualified. It was a sloppy, wet track. It was a great race. He should have let the winner win it like he did." And I'm thinking, oh, God, don't even say that, Trump. But so anyways, I'm sitting there and I'm fine with it. I'm so blessed and everything else. I shouldn't even be betting. And there's a lot of people just crying the blues. But anyways, the dude that won Country Horse is this freaking 165 or no, I think it was 65-1 odds. So you bet $2, it paid like $140, man. So man,
that should have been your bet.
Yeah, I'm saying if I would have
put how many people bet on that.
Yeah, I think if I would have put the $2,000 on that one, I would have won like $300 and some odd $1,000. So it's kind of crazy.
Oh God, man!
But that's all. What a shit it could have.
New milling machine.
Yeah. Oh, I was thinking, man, I'm putting that down payment on my Honda Jet, baby. I want that thing.
That's right.
They're the cheap bargain.
Get a new boat.
I already got that. I got everything. I'm so blessed, man. But so I lost my ass on that, but so did a lot of people. But yeah, I'm not betting anymore. I'm just kind of telling you, Shaun, don't bet, man. You don't need to do that. And these poor horses.
You got to stop betting on these ponies.
Yeah, exactly. And then, so what about you, dude, with NBA? You like any of the teams that are playing, Warriors or Houston or any of the Portland?
I love watching. Yeah, I love watching basketball. I grew up in the Detroit area, so I'm a Detroit Pistons fan. But unfortunately, we've sucked for so many years now.
Yeah, you have.
It's just been rough. And every year they're like, "This is a rebuilding year," but if it wasn't for the fact that the East is so crappy, I can't believe we even made the playoffs. But
I know.
Honestly, looking at the West Coast, it's a hard run there. And I think finally the Warriors might get a run for their money there.
Yeah,
and
they're like tied at 2 games each.
Milwaukee is killing it. Yeah, exactly. Yeah, and I'm happy to see that. Those guys are so talented. Like the Warriors is just one of those teams. It's like the Lakers back in the day, where you're just looking. It's actually better than that.
Yeah,
like it's unbelievable how talented those guys are.
Yeah.
And for anybody to beat them, like they should be proud of themselves to be able to beat a team like that.
Oh, absolutely.
Including the coach. Like Steve Kerr is amazing.
Oh, yeah.
The guys that are jumping off the bench are amazing.
Yeah.
It's just such an incredible team. It's kind of cool to be living through it, because I think we're living through history watching those guys play. I don't know if we're ever going to see a team that talented ever again.
I don't know either, and I don't know if they've got it. But then again, they were tied 2 games last year at this time with Houston, and they came back and beat Houston. And Houston's looking pretty good. They're kind of thuggish, they're being out there and being real tough and mean. But Klay Thompson, man, he hasn't hit any. The Splash Brothers aren't doing anything together. I mean, Curry's still getting his 30 and stuff.
Durant.
Him and Durant.
Durant's been carrying that team, man.
Yeah, he has. And there was a guy that kept going, New York Knicks, every time Durant would touch a ball, because I guess he wants him to go to New York. And there's a rumor he might go there, but it's kind of neat. We got games tonight. I'm excited. Wednesday night, man. Maybe Mom will let me go to the pizza parlor.
Yeah, it's a good time of the year.
Exactly.
Yeah, it's a good time of the year. Again, to watch all the NBA playoffs.
Oh man, I'm
my
into
favorite
it.
Time of the year.
I would like that Giannis, that Greek freak, man, from Milwaukee Bucks. I'd like Milwaukee to win it all, man. I like to see them going.
That guy's nuts.
Yeah, he is.
Yeah, he's probably the closest to Durant style, where he's a guy that's like, what is he, like 6'8" or something ridiculous like that? But he can handle the ball like Curry and
I think
shoot.
He's got like a 12-foot wingspan. I think his arms are like it's something ridiculous.
Kind of nuts to watch play.
Yeah,
I was actually looking up, because he's kind of an odd guy. He's Greek, right? But he's like clearly like an African American guy or African.
Yeah.
And I remember looking him up, and because there's not a lot of you don't see a lot of that type of diversity in Greece.
Exactly.
And I guess he was a migrant. Like he grew up as a refugee in Greece from Nigeria.
Oh, you're
kidding. He only got into basketball like in high school or something crazy like that. Like he didn't grow up playing basketball since he was a tiny kid, and he was like quickly, like people paid attention to him really quickly, and he just moved through the ranks real quick, and he was scouted into the NBA, and he's just been killing it.
Oh, heck yeah. And he was kind of unknown for a while, but this is the first time this year that I've ever watched him, probably a lot of people, but I'm very impressed with his personality and his athletic ability, because
he's a freak. He's a freak.
The Greek freak. I like that, man. That's cool.
Yeah, the Greek freak. That's a great nickname. Yeah, that's a great nickname. Watching him play, he's amazing. He can move, he can shoot.
Yeah, he can. And
it's a good time of the year.
Great personality. LeBron was asking him to go in his Space Jam 2 movie, and he said, "No, I'm not interested in Hollywood or movies. I'm a basketball player, and I just want to fine tune my skills in the NBA, because that's what that's what I do for a living." And
really? I didn't know that.
Yeah, I like that when he said that. Give him another 5 years and a couple MVPs and a couple of championships, and he'll be going Hollywood probably then. He'll probably say, "I'll do some movies." No. You never know. All right, dude. Hey, let's dental up, man. So tell me, doctor.
Let's do it.
Why did you get into dentistry, and at what point did you think, I want to be a dentist?
Oh man, I actually stumbled into dentistry by an accident. I always say that I just got really, really lucky, because had I not liked dentistry, it would have been a miserable career. Because if you don't like dentistry, it can be stressful. And you got to work in someone's mouth all day, and you got to deal with people that most of the time don't want to see you. So in high school, I went through high school. I quickly mentioned that I did sales. So pretty much right around grade 9, grade 10, I got my first job in sales, and I worked on commission. And I never looked back, and I never understood how anybody could work an hourly wage job, right? So I started doing the oddest. I was like 14, 15, and you do these credit card applications, and you get paid on the applications. And I did like door-to-door gas sales, where you get paid by people you sign up.
Yep.
Anything where I got paid on commission, I was in for it, right? And I worked in Canada. It's called Tim Hortons, the coffee shop.
Okay.
So I worked there for a few years. but pretty much all my young years, I knew I wanted to do something in sales or with people. I'm not the type of, I'm not a paper pusher. I can't sit behind a desk for the rest of my life. Like, I just knew that wasn't for me. And then in high school, I worked a lot on cars. So I wasn't sure if I wanted to go into engineering. My dad is an engineer. My mom's an engineer. And they pretty much talked me out of it. They just told me it's a rough lifestyle, and, no one appreciates you, and you're working for the man for the rest of your life. And they kind of talked me out of it. And I had some uncles and aunts that were physicians, and, they introduced me to the physician lifestyle, and kind of liked that. And then I met someone who was a dentist through my aunt, and I really enjoyed that. And then when I got into undergrad, I played a lot of sports in high school, and I got into undergrad. I didn't know what I wanted to do, so I was studying kinesiology, and then I quickly switched over to chemistry. But I figured I wanted to do something with medicine and sports. So I was trying to get into med school, and I figured I was going to go to med school, and then I was going to, subspecialize in some sort of sports medicine, or I was going to go to physiotherapy and work with athletes for the rest of my life. I just wanted to be involved with sports,
Beautiful.
And then literally a few weeks into undergrad, I ran into some guys from my high school that were, they were 2 and 3 years older than me. So these guys were like third year, fourth year undergrad, and they were, just applying and interviewing. And they were like, no. Medicine sucks. You got to go to dental school. Dental school is where it's at.
Yeah.
And I was like, really? And literally within a conversation, they talked about how awesome dentistry is as a lifestyle and how I should check it out. So I left, and I went and contacted a few dentists in the city. I was in Windsor, Ontario at the time, where I was from. And I contacted a few dentists, and I went and shadowed them. And, and I really liked it. I liked the fact that you work with your hands. I liked the fact that you were with people all day, and it was still sciences. But I had no idea what dentistry really was, and I should have spent more time shadowing those guys, because I really didn't spend a ton of time shadowing. And one of the offices that I did most of the shadowing at, the dentist actually had me working with the denturist. So in Ontario, there's an occupation called the denturist. So the majority of the work that I did when I was quote unquote shadowing was working with this guy. So I was pouring up models, and I was trimming models, and I was working in a lab.
Okay.
So the majority of my time in the dental office was in this lab. They had a denturist in the lab. So I worked with him, helped him set teeth in wax, and worked with some wax, and I liked it, but I didn't really know what a root canal was. I didn't know what a crown was. I didn't know what a bridge was until I got into dental school. And when I got into dental school, I realized I didn't really know anything about dentistry, but I liked it. So, it was just, I feel like I kind of stumbled my way into dentistry, and it wasn't until, we started getting into the clinical portions in dental school that I realized, hey, I really like this stuff. A lot of times in dental school, when we had downtime, I would go shadow some of the other clinics, whether it's the oral surgery clinic or spend a little bit of time with the special needs clinic. And, I like that kind of stuff. And I had a mentor of mine from dental school who was really involved with the special needs community.
Okay.
And he was part of the accreditation board for GPR program. And he told me about this program that was run by one of his colleagues and his friends. And he said, this guy just started this program, and if you want to go to a good program and you don't care where you live, I would say follow him. Go where he's going. He's going to have a great program going there.
Okay.
So I applied to that program, and it was in Canton, Ohio, and it's in the middle of nowhere. But if you're a football fan, you'll know that Canton is where the Football Hall of Fame is.
Yeah,
baby. Hall of
baby.
Fame is in Canton, Ohio. And I actually, coincidentally, lived literally across the street from it. So I got to go there a few times, and I lived in Canton, Ohio.
Cool.
But I ended up going to Canton, Ohio, and I did, it's a random GPR program. It's not associated with a fancy school or a big fancy hospital or anything. But I had the, honestly, in my opinion, the best education someone could ask for. We had great faculty, and, we didn't have an oral surgery program associated with the hospital. So we were in the OR multiple times a week, and, any midfacial trauma, you got to go. And so we'd be first scrub in with any midfacial trauma, whether if it's plastic, ENT, or OMFS, we got to go to OR. Got great exposure to surgery, and, I got to do a ton of stuff that I'll never do in my life again. And, but it just laid the foundation for surgery for me.
That's so cool.
I knew I loved surgery, but this was a great exposure to it. Got to do a little bit of everything, really. But it was a great year, and I got out, and that was pretty much it. I was hooked. I started moonlighting when I was in the GPR program. I used to go to a corporate dental office in the area called Immediate that I would just go in, and they pretty much hired us. You know, when you're a resident, you barely make any money, right?
Yeah.
And these guys would pay us $700 a day to go in and take wisdom teeth all out, and we just got paid per day.
Okay.
So to them, this was a great deal, and to us, I was like killing it. You know, I was making so much money.
$700 a day, baby. That's not bad.
$700 to sign me up. You know, and we literally, and it wasn't just me. There was like from the year before me, there was a couple of residents that did it, and my year there was me and another resident that would do it, and I'm sure it continued after us. These guys would get us. We were allowed to moonlight after December. So you do the first 6 months, you weren't allowed to moonlight, and then the next 6 months you were. So we'd go in there on the weekends. You know, I'd be part of my residency 5 days on, and then if you weren't on call, I'd spend Saturday, Sunday working at this corporate office, taking out wisdom teeth. And it was, you know, we used to joke how it was part of our residency training that we'd go in there to take out wisdom teeth. But it really laid the foundation, because I got out of my residency program and I just knew that for the rest of my life I was going to be doing a lot of surgery, and it was part of my dentistry from that point on. You know,
that's so cool.
And one thing led to another, where probably around 4 or 5 years ago, it just kind of narrowed down to where a lot of what I do is just implant dentistry and taking out teeth. So I'd say about, 80-90% of what I do now is somewhat surgery related, which is very fortunate for me, because I really, I never really liked the restorative dentistry very much. And, I figured if I found something else that I was better at, I didn't have to do a lot of this as much. And I work with every office that I work in. I have a team or other colleagues that I'm with that are really good at it. So I'm happy that I have someone else that I can send that stuff to. So we just, we figured out a way that someone else will do the things that I'm not as good at. And, they send me some of their stuff that they don't want to do, and I'll do that. And, but it's been so far, 8 years, it's been a good ride, and I can't wait for the next 60 years, because I'm never going to retire. I'm going to die in a dental office somewhere.
Yeah. Wait till you turn 50, man. It might change. You get a little wiser, and you might be thinking, no, that's just with me. But I'm 36 years in now, but it's just something, you got to have, you have a passion for this. And, I could just feel it when I talked to you the first time I talked to you, and ton of CE that you've done, man. And I think that's just so important as a younger dentist starting. The more CE you can do, the better. And I mean, you with your implants, you've sinking and you're doing so much with it. Heck, you're even talking about some sinus lifts. I can't even watch a sinus lift on a video, man. It's like that's scary stuff.
I wish all I could do was sinus lift, honestly, but there aren't that many sinuses in the world.
Yeah.
It's kind of a fun little technique, sensitive procedure, but you just go a little bit slow, and I don't know. I remember the first time it was Dr. Stuart Orton-Jones was the first time we were talking about it, and he said that. He said if he could just work 2 days a week and just do nothing but sinus lifts, he'd be a very happy man.
Oh,
and I thought that was really odd for someone to say that,
Yeah.
Until I started getting more comfortable at him. The first few that you do, you're definitely nervous.
Yeah.
But I remember the very first few sinus lifts I did in residency. We kind of helped out in dental school, and you watch people do them and stuff. But the first few times we did them was in residency, and it was kind of cool. We had an oral surgeon that was a little bit of that we worked with in our residency. He was a little bit of I want to say, like, he was just he wasn't a cowboy. He was an oral surgeon. Okay. Oral surgeons are a certain way. Yeah, and I remember we took out a tooth, and we were right next to the sinus, and I wasn't sure if we exposed the sinus or not. And he was like, "Oh yeah, well, what happens if you expose the sinus?" And I was like, "I don't know." Thought it was a bad thing. And he just grabs an explorer and he pokes through the membrane. He goes, "Uh-oh, we just poked through the membrane. What's going to happen now?" And I was like, "I don't know." He was like, "Nothing." And, like, you working in that mentality, or, the first time we knocked a root in a sinus and we had to go grab it, or, draining a sinus with an oral surgeon. So a lot of these things I got to do really early on in my career, where now, in private practice, if one of my colleagues knocks a root into a sinus, they'll send them over and I can remove it. It's not really the end of the world. Or a few weeks ago, I haven't pushed a tooth in a sinus since probably residency. And a few weeks ago, I was removing a wisdom tooth, and it, I popped it into the sinus, and I had to luckily it wasn't very far in and I could just, open it a little bit and get it out. But, I feel like having that basic education that you get from spending time, like you do things that you're never going to do in private practice, but it prepares you for the smaller things that you do in private practice.
Oh, absolutely.
And you get that from being in a hospital setting for a year with these guys. But when I run into new grads and they talk about classes, I'm a huge fan of taking, learning about everything, because when you first get out of dental school, you really don't know what you like and what you don't like.
Exactly.
And there's one of my biggest pet peeves is talking to new grads that tell me, "Oh, I'm great at surgery and all I want to do is surgery," or "I love endo and that's all I want to do." And I'm like, it's very, very small chance that you actually know what you want to do, because when you're in dental school, you're barely exposed to anything. You just barely learn. And when you get out, just keep an open mind. You never know what you're going to want, you're going to like. You might be the next TMJ guy or the next sleep dentistry guy, or, the guy who just loved bread and butter family dentistry.
Yep.
There's a ton of money to be made in bread and butter family dentistry, like doing good, well-rounded bread and butter family dentistry. You can make a great living doing that.
Oh.
And I think a lot of people forget that, they think that, I got to do veneers to make money. I got to do nothing but veneers. I got to do nothing but aesthetic dentistry to make money. I'm like, no, you're wrong, And if you're going to be like, the smaller your specialty gets, the harder you're going to get hit if the economy takes a hit,
Yeah, absolutely.
So if you're the guy that just does veneers all day and, all of a sudden the economy takes a little bump, you're going to be the first one to feel it, because people aren't getting veneers when they can't pay the bills.
Oh, I know. I lost 80% of my cosmetic business after 2008, 2009. I used to do so many veneers, dude. All the non-prep veneers, or minimal prep veneers, and I had so many doctors limited to cosmetics and full rehabs and full veneer cases, and then it's gone, and it's like the people didn't have all that flush money, and they're like, "What do I do?" But probably 80% of my doctors are just onesie twosies. Little bridge here and there, but they're sleeping well at night, and that's right. There's plenty of dentistry in the mouth, but that you don't have to go and push it and everything else. And it's just something that you'll be through the good times and the bad times. You'll practice this good dentistry and just keep people, keep people's function right and stuff like that with onesie twosies, man. A lot of guys, that's all I get. And, but then I still got guys that, they get the bigger stuff too that comes through every once in a while because they have the experience to do it too. And it's just, and that's where the education comes in. Yes. And that's really where the education comes in. And with trial and error. A buddy of mine calls it low risk. Yeah. One of my really good friends calls it low risk dentistry. And he goes, I don't need to do that stuff. And he makes a great living. He's got a very successful practice, and he's been in private practice straight out of dental school, and he's doing very well for himself. And he calls it low risk dentistry, and I don't have to put myself through that. I want to sleep at night and make a great living, working 4 days a week. Oh, absolutely. But I think a lot of the young guys forget that, right? And that's why having mentors in life is so important. Unless they see these guys that have been doing this for 20, 30 years, and they're just absolutely crushing it, and they're not doing anything crazy fancy. They're just doing good, honest dentistry for years, and that like you said, the money will come. You just keep at it and the money will come. Exactly. And have that customer service and treat your patients like family in a way. And it's not a job. And there's so many dentists that get through dental school, and I think they didn't realize what it's all about. And once they get into it and they work for an associate or whatever it is, they never had any idea it was going to be like that. So I see a lot of the people, they're not sure they really are into it after you go through all the learning and then you get into the real world. And it's just, it's a mindset, man. And it's just how that predictable dentistry is the best road to go, I think, because I got a lot of guys that are just 2 days a week, they're like 2 days and I'm still fine. And then my younger guys they're 4, 5, 6 days a week, which I think you should. You need to be a worker beam. And you're flying all over, dude. You live in Canada and you fly in. Yeah. Man, we need to get you. My weeks really changed. Like my schedule is all over the place. Like I don't represent. It's funny. I had a dental student that was shadowing me. Okay.
When in our office in Texas, like we almost always have dental students or students that are trying to get into dental school that will come around and shadow, right? So one of them was shadowing me, and I just told him, I said, listen, like, this isn't traditional dentistry. Like, you're not, like, I don't think I live a regular lifestyle, but most likely I won't be like this forever and ever, but I have the energy for it. I have the passion for it. My back is still not broken,
Yeah.
Like so many other dentists out there, my shoulder's still working. So, I'm doing it while I can, but I probably won't be doing this for the rest of my life. And, at some point I'll slow down and try to, just try to simmer down a little bit, calm down a little bit. I've been all over the place for a while.
Well, dude, tell me a little bit about Laredo, Texas, man. What's it like there, and what's the practice like? Laredo, Texas, is that like on the border of Mexico or no?
It's right on the border. Yeah, it's right on the border. If you don't like Mexican food, don't go to Laredo, Texas.
Yeah, I love Mexican food. Give me some chili killies, baby.
Yeah, that's right. When my wife and I, when we first went down there, it must have been like 6.5 years ago. I think it was like December 6 years ago. Okay. When we first went down there, we thought it was the coolest thing ever because we walked into an H-E-B. H-E-B is like the grocery stores in Texas. Okay. And there was fresh salsa and fresh tortillas. Like you can buy fresh salsa and fresh tortillas there. And we were like sold. Like, we're moving here. If you can get the best Mexican food, we're moving here. It was that was one of the biggest selling points is that. But the culture there is it's primarily a Mexican culture because it's a border town. Okay. We're neither my wife or I neither one of us is Mexican background. My wife's name is Maria and she's brown, so everybody thinks she's Mexican, but she's not. My wife is Indian, and so she could easily pass for Mexican. And actually, matter of fact, when we go out for dinner, they'll come up and no one will ever speak to me. They'll always look at her and speak to her in Spanish, and they just assume I'm her gringo husband or something. And it's the funniest thing. They just always speak to her and assume I don't speak Spanish. But it's predominantly a Mexican population or Mexican ethnicity population. And it's a very odd place. It's a little bit isolated. It's a 2-hour drive from San Antonio. But it's a great place. It's been good to us. We've been there for a while, and it's been good to us. And honestly, the only reason I haven't said this yet, but I actually currently most of the time I live in Toronto, Canada, and I fly to Texas. But the reason we kind of made that little switch over to Toronto has just been because of our kids. We recently had a kid, and we just had our second child, so now we have 2 kids.
Yeah.
And we wanted to be a little bit closer we wanted the kids to be closer to their grandparents.
Okay.
So we kind of moved back, but if it wasn't for that, we probably would have never left Laredo, or at least never left Texas.
Oh, I hear Toronto.
We have a close. Yeah, Toronto's a beast, man.
Yeah, I heard it's so beautiful.
City in North America.
Yeah, me and my wife want to go. I mean, it's so close to us. Yeah, it's just
anytime, man. Yeah, you guys come on up here and we'll host you.
I'm ready.
Stay with us for a weekend. No, you'll love it, man. Just come in the summer because you Southern Californians won't survive out here in the winter.
Hey, I got high blood pressure. I like it when it's cold, baby. My wife, she's different. She needs to put the jackets on. Kind of crazy.
In the summer, it's kind of like Chicago. If you know anybody from Chicago, I'll tell you the same. It's like you get that summer. It's like 8 weeks or so of summertime, and the city is just completely different. Like you don't recognize it. Downtown is gorgeous. Every single weekend, I can't say there's one thing going on. There's like 10 things going on because it's such a short season, right? So you have the Greek Fest and the Italian Fest and the Jazz Fest and the Film Fest. And it's just so much happening all over the city in the summer. Yeah. So it's been fun. It's been fun living out here. And we both love food. And, you can't think of any kind of culture or food that doesn't exist in Toronto. It's a little bit like New York in that sense. So, Indian food and Chinese and Italian and Portuguese and anything you can picture or want exists out here in Toronto.
That's what I hear.
It's been fun in that sense.
It's Drake's from there.
Yeah,
Isn't Drake a Toronto guy?
Drake's from here. Yep, that's right. Yeah. Yeah, apparently he's built a mansion. We live in North York, which is, it's like one of the boroughs of Toronto. It's like Queens in New York.
Okay.
So we're like 15 minutes north of downtown. Okay. And apparently he's got a mansion that's built out here near us where we live. And I was shocked that he's even got a place out here, but apparently he's got a mansion out here.
Yeah, some like 30,000 square foot monster of a unbelievable thing or something. It's crazy for singing songs, man.
Yeah.
Not even singing,
singing songs.
Oh, they're talking songs. It's not even singing. It's like Ba-ba-da-ba-da, you know.
That's right.
I'm more of a...
Yeah, I'm in the wrong field, man. I'm here trying to stop people from bleeding and stuff. Like, can't handle my blood pressure. I'm all stressed out all day.
Oh, that's funny. No, that's so funny. Well, hey, dude, what about...
singing songs.
What's some of your thoughts on some of the new technology, the CAD CAM, scanner, stuff like that? What are your thoughts on that?
Oh, I love it. You know, I haven't adapted all of it yet. I know there's guys out there that are just living this stuff, you know, but I would love to get there. I do some guided implant surgery every once in a while.
Okay.
And we do have a CBCT in the office in Laredo, and I'll scan a lot of I'd say about 80% of my implant patients. I'll get them scanned first. So, I do use some of that stuff. We have a E4D, the mill and the scanner over in Laredo, and we scan crowns in some of the offices. I'm out here, so I'll scan some of my implant cases as well. So, I've dabbled in it. I'm aware of it, but I want to get into it. I know there's the guys that are printing their models and they're printing their skulls and they're doing their surgeries before they do them in the mouth. And I can't wait to see where it's going to be in 10 years.
Yeah, it's
crazy.
It's
funny because we were just chatting about it with a friend I want to say like 5-6 years ago, I ran into one of my dental school faculties, and this guy was like all about the tech stuff. And I asked him if he's got a CEREC in his office, and he said he doesn't. And I said, why? And he goes, because the CEREC as we know it is going to be gone. Like that technology is not going to be around very long because it's all going to be about printing. He's like, printing is coming and large scale milling. He's like, so it makes no sense for me to buy this tiny little mill machine for $100,000 because these large scale milling machines and printing are going to change the game. And then, that wasn't that long ago. And look at it, look where we've come, printing. I mean, you as a lab know how far printing has come. And it's just progressively, like the rate that the printing industry is going at is incredible.
It's quite amazing.
When you see what they're doing with it in oncology. Yeah, even in like the surgery, the oncology cases, when they're doing these facial rehabs and stuff, it's crazy how you have the whole skull printed out, and you've milled whatever bars you're going to mill to reconstruct the jaws with, and it's the combination of milling titanium and printing stuff is just crazy.
Oh, absolutely. It's come a long way, man.
It's going.
Let me know if you want anything printed, man.
I'm not old. Yeah. Yeah. I'm send you some of these skulls to have them printed first. Yeah, I'm not very old. Again, it's only been 8 years, and just my short 8-year journey, it's crazy how far along it's come.
Oh, so you've had more in the last 10 years than it was in the last 30 years before it. So it's it's just crazy. And you young guys, you guys are the young adapters, and it's a neat thing. It's becoming more and more predictable. Like he said, man, we do something, or Dr. Toops last week on the podcast, Shaun, we do some, he's from Louisiana. He goes, Shaun, we do stuff, man, there's a lot of variables. Things can go wrong. And I'm like, dude, you're telling me. I know that. There's a lot of moving parts, but now it's kind of getting more and more predictable. And, from shade matching to fit to, strength, it's really come a long way, and it's joyous. And it's like, that's why we're so happy on the darn phone with all our doctors, because most of our doctors that work with us kind of get it. We don't have a lot of guys that fly by night and use us a little bit and go. If they try us and use us, they usually stick with us, and we usually are a variable in their practice that is eliminated in stress. There used to be a lab could bring a lot of stress to a dental office, where us, we kind of get it. And there's a lot of other things a dentist can worry about, so it's just something.
You think about even simple things like the full arch cases. Yeah. Like you remember, back in dental school, when you do these bridges and you got to do, you do your metal framework trying, taking an impression, a full arch impression on multiple implants, like that was a day thing, you would glue, you'd find a way to glue all your abutments together, and you do your open trays impressions, and then, you got to do your framework try-ins and cut them and solder them. And, there's so many steps. And now when I do those, like you scan your scan bodies and whatnot, send them out, and things have just moved in a completely different direction.
I can nail it.
The amount of things that,
I can nail it now without even,
so much easier.
I got doctors that, no, Shaun, I got to do a metal try, and then we're going to do a pickup impression, and we're going to solder it and all these. And I tell these doctors, dude, you send me a good impression, you make sure that thing's temporized, and I go straight to finish, and 99% of the time, man, those things drop right in. And I want a bisque bake, and I say, treat it like a bisque bake. You know, I want to fully glaze it, send it to you so you can get the full depth of color, and then let me know. You know, go ahead and grind on it. You can say, hey, Shaun, I need a little more width on the laterals. I need a little height here or there. Grind on it, do everything you want, then send it back. I'll reglaze it, but I don't want to send it to you unglazed and just for you to do your things. That's kind of, you don't need to do that anymore, baby. You want to take those temps off once, because those teeth like to move more than we think. And, you know, you start moving those temps on and off every 3 weeks, and things are moving more than we'd like to think they do. And it's not right. So pull it off one time, go in. Yeah, it's crazy. So, dude,
it's changed that. It's changed that. I love it.
Oh, totally, man. So tell me, let's wrap this up here with what advice can you give some of our newer dentists starting out? I mean, we got a lot of younger people like yourself, but you've just been in the trenches so much with surgery, and you do a lot of it. But what kind of advice can you give some of our newer people, though?
You know, I run into a lot of new grads, actually, at a lot of conferences and stuff, and I love working with new grads. I love being around some of the seniors and the new grads. And I love hanging around with them because I love their energy and their passion for dentistry, because they're still coming out. They haven't been scarred. They haven't had the crappy jobs yet. They haven't been burnt by the bad patients yet, but they still have a lot of positive energy in them. And I love working with those guys. And I always tell them that my biggest piece of advice is find mentors. Yes. You know, and when I first got out of dental school, I kept in touch with a lot of my faculty from dental school, and I still keep in touch with my attendings from my residency. And, you know, if I'm at a random conference and I run into an older dentist that just wants to talk to me, and as you can see, I talk a lot, I will literally take down his phone number, and I'll call him, and I'll email him, and I'll keep in touch with him for years. And there are many people out there that I can list to that I still touch base with, because we all need mentors in our life, and dentistry is challenging, and you're going to come across those cases that you want to just bounce ideas off of. And it doesn't matter how many cases you've done in your life. It doesn't matter how good you are. There's always someone out there that's better than you. And it's great to have mentors to bounce things off of. And to me, it's like, there's nothing that we need more in the field of dentistry when we first get out, especially because we're not like physicians. You know, you don't do a 5-year residency. You're getting out and you're like just good enough not to kill someone, you know?
Exactly.
And a lot of the new grads, they come out and they feel like they're really good. And it's like, dude, you're good. Your dental school good. A good day in private practice, you might do all of your clinical requirements in one day.
Yep.
You know what I mean? And it's like, you know, when you get out, you can't, you're doing yourself such a disservice by feeling like I'm good. You know, you're not good. You don't know anything. Yeah. I've been out for 8 years, and, you know, whatever many hundreds of hours, CE hours, however many implants I place, I still know nothing, because literally the more you know, the more you realize how much you don't know. The more people you run into, the more you realize. My wife gives me hell, because I'm a total CE junkie, and my wife gives me hell about how much time off am I going to take for travel and for learning, because there's never enough. There's never enough learning. There's never enough but you're never going to get to a point where you're going to be like, oh, all right, I got it all now. It's never going to happen. And you're doing yourself a disservice if you feel like you know what you like, or you know what you're doing. You don't know what you're doing. You're just good enough to not kill someone. You know, I go into work every day and I learn something new every day, every single day. You know, there's not a single day where I'm going to work and I feel like, just like yesterday. Nope. Every day you learn something new. And, you know, I work with plenty of talented clinicians and talented dental lab techs and denturists, and I have something to learn from all those people. So if you don't focus on the idea that I don't know anything and I'm here to learn, and just keep an open mind all the time, and, you know, find these older guys that have done it. You know, some of these old guys that are in the 70s and the 80s, those guys have been through the trenches, man. Those, you know, clamp onto those guys and shoot them an email every once in a while, or give them a call every once in a while, or look for them at your dental conferences and just befriend them, and you're going to learn a ton from those guys. And to me, I've been very, very lucky and very blessed to have good mentors all along my whole dental journey so far.
Oh, dude.
It's definitely my biggest advantage in life, honestly. It's just that I've been lucky to have good mentors.
Oh, and so have I, and that is so true. That's great advice, Dr. Metwally. And, dude, I can't thank you enough, man, for your time here. And I know how busy
Oh, man,
you
this has been fun.
Well, hey,
No,
dude.
thank you. This has been fun.
That's so cool. God bless you and your family. And hey, if there's anything you need, man, just call me directly. Say, Shaun,
Thanks, Shaun.
hey,
I
got this implant case. Let's hook this up, baby. No, I'll take care of you, man. I appreciate
I got
it.
to swing by next time I'm in Southern California. I got to swing by and say hello.
Absolutely. You're always welcome here, man. Part of the family, and we'll have our open arms for you and anyone else that comes. We love it when dentists come here, dude. Well, hey, thanks again, and appreciate it, and we'll talk to you real soon.
Take care, Shaun. Have a good day.
All right, doctor. You too.
Bye-bye.
Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.